Hi, I'm Jessica Myers, and I'm doing my HEENT Neuro and Skin video. Right now we are going to scan the room to prove that I'm not using note cards or cheating in any way. Alright, first step, I would check the patient's chart. Next, I would provide privacy. In this situation, we close the door because that's what we have. And in a hospital setting, you would pull the curtain to ensure the privacy of the patient. Next, when either before entering the room or after entering the room, you would wash your hands or sanitize them. So that's what I'm doing right now. Then next, you would introduce yourself to the patient. Hi, I'm Jessica Myers. I'm going to be the student nurse helping today. Can I have your name and date of birth?
Kendra went to 95.
Okay. You would confirm that with an armband or separate identification. Next, I would ask the chief complaint. So I would say, what are you here for today?
Runny nose.
Runny nose. How long has that been happening?
About 3 days.
Any discharge?
Clear.
Okay. Any pain?
No pain.
No pain. Okay. And in a first inspection, the patient's posture is relaxed. No involuntary movements. The facial expression is symmetrical and appropriate. Mood seems to be stable. The dress for the season is appropriate. And next I would ask a couple questions. Do you know what date it is?
It's October 15th, 2019.
Okay, and do you know where you are?
The doctor's office.
The patient is alert, non-lethargic. Speech is well put together, no slurring of the words. And there's no issues with neuro as of first impressions. Next, I would move on to the hair. The first visual inspection, I would say that the hair is not dry, it looks healthy. The texture of the hair is non-gritty. Skin is of normal temperature, normal color. Palpate the temporal artery. Okay, temporal artery is equal bilaterally, +2. The eyebrows and eyelashes are equally distributed. The eyes are symmetrical. Nose is midline. The mouth is pink with no cracks. The skin on the face has no abrasions or lesions. Next, I'm going to feel your jaw. Can you just open that for me? Alright, can you close it? There's a slight pop in the left side of the jaw. Is there any pain when you do that? Okay. Alright, and then I'm going to check the skin turgor. Check that. There's no turgor, seems well hydrated. After this, I'm going to palpate your scalp, okay?
Mm-hmm.
Alright. Do you suffer from any headaches?
No.
Okay. Have you had any falls to where you've hit your head recently?
No.
Skull is of normal shape, no lesions or abrasions. Alright. I'm going to check for your sinuses real quick. Can you tell me if there's any pressure or pain?
No.
Alright. I'm going to next check for your facial sensations. I'm going to need you to tell me in what spot I touch, if it is a sharp or soft feeling. Okay, can you close your eyes?
Mm-hmm.
Alright, how about that?
Soft. Sharp. Sharp.
Okay, alright. All sensations were felt. Okay. Next, I'm going to check your lymph nodes. Sorry, I'm going to just move your hair back a little bit. Okay, I'm going to start with the preauricular, postauricular, occipital, the the tonsillar, submandibular, submental, superficial cervical, and then the posterior cervical. Can you tilt your head for me?
Mm-hmm.
The deep cervical. Do it for this one too. Deep cervical. And can you shrug your shoulders for me? And supraclavicular. There was no palpable lymph nodes, no masses, which is good. Next, I'm going to palpate for your thyroid. I'm not going to choke you, but I am going to put a little pressure right on the side of your trachea, okay?
Okay.
Alright. Okay, thyroid was non-palpable. Alright. I'm going to put some pressure on your shoulders. I'm going to need you to lift against them, okay? Okay. And then can you push your face against my hand? Okay, this side. Strength of muscles are normal resistance. Okay. And then can you tilt your head this way, back, forward? There's no restrictions of range of motion. Alright. Next, I am going to inspect your eyes. As of right now, the sclera is white. The conjunctiva is pink and moist. No discharge coming from the eyes. Alright, I'm going to shine the light in your eyes real quick, okay?
Mm-hmm.
Alright. Pupils are equal and responsive. Shape is round. They were about 5 millimeters. I apologize. 5 millimeters. Both directly and concentrically constricted. Alright, can you look in the distance for me? Alright, then can you focus on this pen? Both eyes accommodated. No issues. Next, I'm going to do the 6 cardinal signs. So if you could follow this pen and don't move your neck, you just follow it with your eyes, okay?
Mm-hmm.
Alright. Okay. There was no lagging or any issues while completing that test. Have you went and seen an eye doctor recently?
No.
Okay. Do you have any vision problems?
No, I don't.
Okay. Next, we would complete a Snellen chart. I don't have one in this room, but then complete that. 20 out of 20. She has perfect vision in this situation. Next, we would do the inspection of the nose. First, I'm going to check the purulence of your nose. So if you could put your finger on one nostril and then breathe in. Alright, and then can you do that on the opposite side? Flow is even on through both nares. Now I'm going to visually inspect the nares themselves. As of right now, it's pink and moist. The hairs are evenly distributed, no deviations, no perforations. And next, we are going to check the mouth. So if you could, can you open your mouth for me? Alright. Teeth are in good condition. Doesn't seem like there's any problems. The mouth and gums are pink in color. No red, no white. The tongue is midline. Alright, can you stick your tongue out for me? Can you say ah? Alright, uveal and soft palate rised appropriately. Alright. Can you stick your tongue out one more time? I'm sorry. Can you move it left or right? Up and down. Alright. The movements were correct. No issues. Can you say light,
Light.
tight,
Tight.
dynamite?
Dynamite.
Okay. And that tested cranial nerve number 12, which is the tip of the tongue. And there was no issues with saying any of those words. Next, we're going to check the ears. Sorry. Both ears are symmetrical. And alright, so does this hurt at all?
No.
What about this?
No.
And this?
No.
No? Okay. I'm going to visually inspect them now. Okay. Both ear canals are pink with normal cerumen. Hairs are evenly distributed. And the tympanic membrane is pearly gray, which is a normal color. Have you had any ear issues? Any
No.
ear infections?
Not recently.
Any pain?
No.
Okay, alright. Is there anything else that you'd like me to know or the doctor to know?
No.
Okay, alright. Well, I'm gonna go put these notes in, and then someone will be with you shortly.
Okay.
Alright, thank you.